the story on Saturday, but we're switching our focus now. And Dr. Analisa Cumberbatch, she's the president of the T&TMA, that's the Medical Association, and also Dr. Rabia Hydal Mohammed. Did I get the pronunciation right?
You got it.
Great. She's also an executive member of the T&T Paediatric Society, and we're talking about a medical research conference, Leaving No Child Behind. Good morning. Thank you for joining us.
Hi, good morning, Hema. Thank you for having us.
Now, Dr. Cumberbatch, let me start with you. I know that every year the medical profession will come together to have this annual conference. Why this topic this year?
Well, every year we focus on different aspects of health that we would like to bring awareness to the public and to our medical fraternity. This year is actually very special to us, Leave No Child Behind. We realize that in the medical field, we would like all of our primary care physicians, GPs, and all our doctors to be aware of what services are available to children with disabilities, and disabilities not just physical, but social and mental also.
And looking at the persons, or the amount of persons that will benefit from this conference, because we still don't have the medical research as to how many children we would fall into that group of special needs. Do you have an idea of how many children?
Not I don't.
Well, for the special needs kids, I know that we have here at this conference, as well as throughout all of the regional health authorities, there are also private institutions, but we have people like Dr. Jasmine Ramcharan. She works at the Eric Williams Medical Sciences Complex. She works at ARIMA as well as Scarborough. We have people like Dr. Natalie Dick working at Scarborough Hospital as well as Eric Williams. We have representation from Community Pediatrics, the Southwest Regional Health Authority. We have representation at this conference as well from the Eastern Regional Health Authority with Dr. Pemberton, as well as Port of Spain with Dr. David Toby, who will actually be one of our award recipients for research excellence. So in terms of actual numbers for special needs, I can only say that we would have limited data at the regional health authorities level, but to give a holistic perspective nationwide, we hope that with the aim of this conference as well, and with the focus on kids who have special needs, that sort of interest from even a national level can be gained, so that all the RHAs can actually come together as a cohesive unit, so that we can develop a plan for these kids with special needs, so that we can tap into all the different resources that we have at the different RHAs.
What are you hoping to achieve in this conference?
Well, the conference, first of all, I mean, there are different phases. We like to achieve different goals. Of course, on a national level, we would love to implement policies and changes with respect to that level. But right now, what we want are our doctors to be aware of what is out there. And we're hoping that at least if one doctor from each public health facility attend the conference, the discussion, the topics of discussion are so important with regards to adolescent teens who are cutters, to children with physical disabilities, but not only that, how they could actually advise the parents on the different resources available to them, and also how they could communicate with the parents of children with disabilities.
What are some of the challenges that parents, when you talk about parents learning to communicate, what are some of the challenges that they encounter?
I think one of the major things is the first line for a parent is not a specialist, it's a primary care physician. And of course, I'm a primary care physician also. And we are a little bit limited on the specialty areas. So when they approach a primary care physician, one of the challenges is the knowledge, being able to be educated on first of all, the disease and how they can actually help their children in our facility. So what we try to do is bridge that gap between the specialty and the primary care, so we can actually be that first line of education for these parents.
And let's talk a little bit about the conference itself. Now, this is for the medical professions, I'm assuming.
Yes, it is.
And tell me a little bit about some of the presentations. And, you know, every year I know there are a number of papers that are presented because it is a research conference as well. Who will be presenting at this year's event?
Okay, so part of the Paediatric Society of Trinidad and Tobago, the aim is to really educate and foster continued pediatric medical education. So the conference is not limited to just pediatricians, pediatric-related nurses, but as Dr. Cumberbatch said, the primary care physicians, the general practitioners as well, in order to bridge that gap, because sometimes there's a fear of just children who are abled compared to even differently abled children. There's a fear in actually approaching them. So some of the topics that we're having at the conference include the future of the child with special needs. Where do we stand? From Dr. Ramcharan, our developmental specialist at the North Central Regional Health Authority. We have Dr. David Toby, who's doing Bosi Back and Beyond, a look at the work of the Princess Elizabeth Center. And I mean, the Princess Elizabeth Center has been founded for more than 50 years. I think it was a gift from the Red Cross to Princess Elizabeth upon her engagement to Prince Philip. And you know, he's been there for many years doing a lot of corrective surgeries, for example, for children with cerebral palsy. So it'll be very interesting to hear his presentation and perspective, because the wisdom that we can get from these generations of people who have dealt with pediatrics and children with special needs, we may not have that, and we can definitely learn a lot more. We also have Dr. Pemberton talking about adolescent access to healthcare services. So I really like, from a pediatric perspective, that we have a whole mental health sort of components to it, because adolescence is also, I think, at-risk population to some extent, because they're going through a developmental phase. And so it's really nice to have her incorporated in our program. We also have a parent's perspective on the educational provisions for children with special needs. So the challenges that they face as well, and what came out of that study. We also have in the Southwest region, a kids filter clinic was trialed to see if it is that, you know, it made a difference in terms of waiting times, the parents' experience for children who present to the emergency department rather than at the health center. We also have congenital Zika syndrome from Dr. Natalie Dick, who has been heavily involved in a national Zika plan. And so we really look forward to their input, as well as risk factors for hearing loss in a neonatal ICU. And we have advances in pediatric neurology.
What has been the interest level expressed in the medical fraternity for the conference so far? Are we just seeing it geared towards pediatric doctors and those who are interfacing with children?
Actually, no. The interest is actually quite broad. We are looking at occupational therapists, physiotherapists, psychologists, sociologists. So it's targeted to everyone, and we have marketed it and promoted it to all the different aspects of healthcare. And so far, the buzz is there.
So definitely something to look forward to. Daytime details, just a reminder to all those who may not be aware of it as we wrap the interview.
It's on Sunday, this Sunday, the 28th of July at the Hilton Ballroom. It starts from 8 a.m. to 4 p.m. And you can actually register or RSVP at tntmedical.com.
So definitely something to look forward to. When we come back, we'll begin